their experience in preparing for the Idaho Patient Act. And Lisa and Callie and I have been working together for a little over a year now. They are providing collection services for our MIHA members in early out space and some bad debt space. And so I just wanted to let everybody know that if you have any needs in that area, I'm happy to connect you with Callie and Lisa offline. You can chat with me today about it, or you can certainly reach out and email me. So I don't want to take up any more time with my chatter, but I want to make good use of our time today. The Idaho Patient Act is, yes, in Idaho today, but we've had discussion on our revenue cycle calls that it could be coming to a state surrounding Idaho. And I think one of the hospitals that mentioned the fact that they wanted to have more education was Benefice, because they feel Montana might be next on the list to adopt something like this. So I think it's great education, not only for the Idaho hospitals, but then also the rest of our members. So thank you everybody for taking time to join in. Make sure you sit back, have yourself a nice cup of coffee or whatever your lunch beverage is and some food, and stay nourished while we have this education today. So thank you.
All right, thanks, Janelle.
Thank you. And Lisa?
Yeah, I am Lisa, and I think, Lionel, you got your camera on. Janelle, if you want to try your camera now, hopefully that works. Fingers crossed, all of you. There's Justin. All right, so I think we've got it. Hit the right thing. I'm Lisa Kirk. I'm the Vice President of Sales for Ensource and our affiliated collection agency, Professional Credit. We have helped a number of healthcare providers with the Idaho Patient Act. Excited to have Lionel and his team here today from Steele Memorial to share their experience. I am a past president for the Idaho HFMA chapter. We did a similar webinar, had a lot of interest from the chapter. So some of you may be seeing some repeat information, but as you know, with the changes that came this year and the delay, there's some additional changes. So I want to make sure that everybody's aware of those. So I will hand it back to you, Callie.
We're among excellence. Like Lionel, you look like $1 million, your camera on. Does anybody else have challenges coming camera on? Annie, I know we were hoping to see your face. There's Janelle.
I'm not getting anything.
I'm not getting anything either. This is Shari.
Okay, so you're not able to hit the video option on the lower left corner of your screen?
When you hit it, it says cannot start video, failed to start the video camera.
Oh, there's Tina.
Oh, there's Tina.
Hi. Oh, there we go.
Oh, we did it. Annie, look at your new hair. I love your hair, Annie. Is it short or is it back?
It's very short.
That was worth the price of admission, you guys, coming on right now just to see Annie's new hair. Okay, so Annie, can you introduce yourself really quick and your team? Because I know you had a lot to do with the Idaho Patient Act internally with Steele. And then Lionel, when do we lose you? I know you've got a board conflict at what time that we just need to watch the clock.
She gave me a range from 12 to 1 to call me.
Call you. So yes. If Lionel disappears, guys, it wasn't anything that we said. He'll come back to us as soon as he can. Mm-hmm. But Lionel, since we have you now, let's just really quick. You and I, we started this conversation last year about this time. We knew this was the Idaho Patient Act, kind of felt like a poorly wrapped package, a gift, right? It was kind of like, oh, we don't really want to deal with this. Knocking on the same door as the price transparency deadline. So a lot of facilities and critical access rural health centers had to choose which one they wanted to focus on because they couldn't do both. So as a CFO, a couple of years into Steele Memorial Medical Center, what was kind of the biggest thing of the Idaho Patient Act that got your attention?
Probably that got my attention would be the possible penalties. But let me back up by starting to say thanks to everybody on the team, Annie, Tina, Shari, and Callie and her team, because I feel highly successful because I got lucky and was surrounded by this team. I don't know all the details to the Idaho Patient Care Act, but the team took care of us and took care of me for the most part. They really make me shine. And when I talk this to the board, couldn't have done it without the board, without this team that we're looking at right now. And I think, the secret to the success of this team is empowering the team to make decisions, not have to run to me every time they needed to do something, but to give them the authority to make changes with your team, Callie, to just kind of inform me what needs to be done and to do it. And if you can't catch me, grab me by the ear and pull me in and make me play along. So, of course, the penalties, that's probably the biggest scare factor.
Well, and that's exactly right, to be put on the naughty list, as it were, of the Medicare.gov site. There were a lot of facilities that we were aware of, and increasingly so, that made the decision that they weren't going to do the price transparency. They were going to take the hit because they didn't have the wherewithal to focus across the board on everything. So a lot of places needed to make strategic decisions based on the timing and the penalties. And what CFO doesn't like to keep things high level, right, Lionel?
Yep.
So with that, Annie, I know a lot came on your shoulders. We started with some pretty robust consent to treat language verbiage changes. Could you talk the audience through that, please?
Yeah, so a lot of our consent to treat that we updated was talking about the financial agreement and our, let me see, the Consolidated Statement of Services. By putting that in our consent, having the patients review it and sign it, then it automatically goes into the Epic record with the consent. So it's all done at one time. We also put in our consent information on what is the hardware that's needed to access your statements electronically, how to be able to opt out if you didn't want electronic statements. Any of the laws, again, relating to the Patient Care Act are documented in our consent.
Well, there were so many robust changes, and just to give everybody just a little thumbnail sketch of what Steele Memorial Medical Center does, and then Lisa's going to just do a quick overview of what the Idaho Patient Act is. Shouldn't be a surprise to anybody in Idaho, but as Janelle said, even though we anticipate that this is only in Idaho today, we think this is kind of the trend line across the country, is to go to more conservative, more challenging, shall we say, on the provider expectations. So really quick, Annie, you guys are utilizing an e-signature component, correct? The consent languages, the patient at admission, whether it's through the ambulatory or inpatient, will sign that electronically, and you're an Epic shop, right? Through Providence Community Connect. So for everyone, you understand there's a ticket, there's a price that comes with changes to any EMR. So our goal was to avoid that. We didn't want Steele to have to take any more additional changes or fees with the Providence Community Connect. So we really wanted to use simple systems. So the e-sign process automatically uploads. And then could you just really quickly, and then we'll tee it over to you, Lisa, to do the overview, that Consolidated Statement of Services, Annie, how did you handle that internally with your staff to get that patient signature upon discharge?
Okay, we actually are doing it upon admission. Anybody that registers at the time of registration is going to get the consolidated statement form at that time instead of at discharge. We just are trying to get everything that's financially related up front and done in the beginning, so nobody has to worry about it at the end.
So simple systems, that's the name of the game. Focus on simple systems. For those that are attending that maybe not be as far down the pike as we are, is that what advice you'd give, Annie, is just to focus on really simple systems? You don't have to reinvent the wheel. What advice would you give?
Yeah, very much keeping it simple because there's so many people wearing so many hats nowadays. The simpler you can keep it, the easier and the more, the better the workflow.
Excellent, because training, employee training is always a challenge, right? And that was
Yes,
before pandemic times.
yes.
So excellent. Thank you for that just little overview. Lisa, for those of us that are joining us that aren't intimately involved with the Idaho Patient Act, would you like to just give us a quick overview? Maybe they're joining us from Montana or Wyoming or somewhere else.
Absolutely, yeah. So I think I see Ray Potter. Hi, Ray. Good to see you. We want to just make sure that everybody's aware of what the regulations are of this law that goes into effect on the 1st of July. And there's actually pieces of it that are in effect now. Let me make sure that I am sharing my correct screen. Get you on display mode.
I feel so much better about my desktop now.
I can even clean that up is the scary thing. All right, how's that look? Looks like we're on the right screen to me. Okay. So just a high level overview of what the Idaho Patient Act is for everybody's frame of reference. I'm not sure how many we have outside of the state of Idaho. For those of you in the state, this should be old news, but the Idaho Patient Act establishes framework for healthcare providers to follow before they're able to perform extraordinary collection actions. This arose out of the Melaleuca case. If you're familiar with that one, he had actually a member of his staff who had a medical bill for just under $300 that led to the request of over $5,600 in attorney fees. So significant amount of fees. Of course, he had a lot of resources and really pushed this through. So what the bill does is it significantly limits the amount of attorney fees that can be added onto that principal balance. There are a number of mandates that have to be adhered to. And the biggest thing is that the burden of proof is on all of you. So keeping track of when all of these timelines are met is going to be on your shoulders. Just what you needed, right? One more thing to keep track of. And it does go into effect on July 1st. So this is an updated kind of checklist of things that need to be done. This was originally supposed to be going into place January 1st of this year because of all of the challenges that everyone was facing with COVID. It did get pushed out, thankfully giving you guys some time to get ready for it. Steele Memorial, they were ready for it on January 1st. So you guys were all set, had worked with Callie and the Ensource team to make sure that everything that needed to happen was in place. So we've had kind of this extra 6 months now to make sure that those processes that were put into place are working effectively. So essentially, what needs to happen is within 45 days, charges need to be submitted to insurance. And the thing that has changed is if you've seen this diagram before, is they've split out what happens if you want to be able to use extraordinary collection actions, or what happens if you don't. So if you want to be able to pursue with legal collections, if you want to be able to charge interest, to credit report, you do need to make sure that all charges are submitted within 45 days of that patient's service. A consolidated summary of services, which was what Annie was talking about, needs to also be provided. There's a number of different regulations. I'm not going to dive into that because I'm going to assume that most of you are aware of that, but within 60 days, that needs to be sent. There's some extra timelines that are provided to you if you do not plan on shifting legal costs to the patient. So that's what's diagrammed here on the right-hand side. Final statement, that's been an area of confusion as well, just because the terminology that's been used in the Idaho Patient Act is not in alignment with typical billing lingo that's used in healthcare. So the final statement is actually the first statement. So that the patient gets, showing what they're responsible for. There's a number of additional things that are required on that statement as well, which I think we'll probably talk through with the Steel Memorial Group and how we worked together. Ensource worked with Steel Memorial to make sure that all of those requirements were met. After these deadlines are met, just wanted to make sure everyone's aware of the fees and costs associated. So if the deadlines are missed, the healthcare provider may not engage in extraordinary collection actions against the patient. They may, however, continue to collect that principal balance. So that doesn't mean that you can't collect if you didn't get the charges submitted to the payer within 45 days. And these are some of the additional fees now that can be added onto that balance. So significantly reduced, as you saw in that initial account that kind of kicked off this bill. $5,600 was the total that was added on there. Now they're capped at $350 and $750. And so it's significantly less that can be added on there. So I will kick it back over Callie for those questions, or for Steel Memorial to be able to talk a little bit more about their experiences being compliant.
That was a really good overview, Lisa. Nice job. I think one of the biggest things that Steel and Tina and Shari, as our new business office manager, and Annie, that we worked very carefully on is there are departments that just historically tend to take longer. They're late posted charges. Specifically with Steel Memorial, it was pathology and rad bills. Historically took a little bit longer. So Annie, could you speak to that? One of the biggest things that we needed to identify, you guys, and this is something we'd ask for you to consider as well, for any of your non-employed physicians or independent contractors, those all have to be attested to, because part of this is to avoid kind of what we've all heard over the last year and a half, the surprise bill, right? The anesthesiologist, the pathology, the rad bills that are not employed. So the first step was we had to identify the non-employed physicians, get their contact information, and then basically educate the patient that they may be receiving a bill from them separately from Steel Memorial. So Annie, would you be willing to speak to that a little bit? I know I'm putting you on the hot seat today. It's so nice that you have that hair, beautiful hair.
Yeah, so we actually did put, again, in our consent to treat a blurb about that they may be receiving a bill or maybe getting treatment from a provider that is not a Steel Memorial employee. So that is in our consent. And then when we give them the Consolidated Services, then all of the providers that we use that are not hospital employees that do send out separate invoices are on that sheet as well. So they know exactly who they may or may not get a separate bill from.
Well, and you said that very well, Annie. Now, just so everybody knows, you came in as the interim HIM director for Steel Memorial and are now the acting rev cycle director. Is that correct?
That's correct.
So would you be willing just to introduce your team? And it looks like Shari is the first one. So if you want to introduce Shari, and then we'll have you, Shari, say hi to everybody.
Okay. Go ahead, Shari.
Hi, I'm Shari Jensen. I'm the Patient Financial Service Director. I'm just started in this role, so kind of jumped in learning this IPA. We did a training on it in Idaho Falls, learned a lot, and so we're just jumping on the wagon trying to get everything in order.
And you are doing such a great job, Shari. How long have you been with Steel Memorial?
10 years.
10 years. Not too many things you don't know, right?
I could learn a lot more.
Good response. Good response. As we're moving through, it looks like Tina is the next contestant on The Price is Right. So Tina, yes. You have just recently made a change. So if you could just help everybody kind of understand.
Yeah, I was the patient financial counselor, or sorry, I just went back to Shari's old job. I was the patient financial service manager when we were trying to get all of this accomplished and underway. And just about 2.5 months ago, I'm now in quality and grievance area, which, yeah, nobody wants the grievance officer position, but here I am. So yeah, Annie and I definitely put a lot of work into trying to get all of this figured out and arranged. And Shari coming on and going to that training is going to help us to close the circle. So
Well, and our goal is to avoid any grievances coming your way through the Idaho Patient Act. That's our goal.
that would be appreciated.
Right, and let me just add in that we commandeered Tina over to also work with our patient informatics with all the ACOs coming on and the new Medicaid VCOs. We need a lot of help over there with valued care services and that type of area where we need. I like to call her my data scientist because I heard a CFO out of where was it the other day? Boston, out of Boston. She had her own data scientist. So Tina's now my new data scientist.
I love that. Tina, whether you were aware of it or not, you are now the data scientist.
Does that come with a raise?
So I think one of the biggest things that we needed to work on, you guys, was identifying the inventory on the front end. Because as Lisa said, if for any reason the charges are late going out the door, or for any reason there were no late, we weren't able to deliver that consolidated statement of services, we have to follow a different path, right? We cannot report to credit bureau. We cannot charge interest. We cannot pursue a legal remedy. All of these things are paths that Steel Memorial allows Ensource and professional credit to do normally for inventory that doesn't fall under this special bucket. So the most important thing, since we're all in the boat of liability together, is to make sure that we earmark those accounts and channel them differently, almost a different path, if you will. So that's another big thing. The statements alone are enough to make your hair curl. And so that's why I'm kind of trying to keep my hair tied back today, because it got so curly with this. We do have Tammy Kuhn on, I believe. Lisa, is that correct? Is Tammy with us? If we could bring her on as a panelist just to speak to what Annie and Tina and Shari and Tammy did regarding the statements, because what we did was we took a more conservative approach. The final statement, as they call it, we call the first statement. We give that same level of detail throughout the whole pendency of the statement process. That was a strategic decision that Tammy made. So Tammy Kuhn, would you be willing to unmute yourself and come on? There she is. There's that beautiful face. I'm going to spotlight you. There we go.
Oh, good.
So talk to us, Tammy.
Yeah. So what we did is we did take a more conservative approach, because what we realized is, well, what if we just made the first statement to match the Patient Idaho Act? What happens if for some reason that patient doesn't get that first statement and then they get the second statement and it's not on there? So we wanted to ensure that the patients would always have in their first 3 statements be able to see the same information, so that we were, that they were covered. We didn't just go with the one. And so we just chose to take that conservative approach, just to make sure that they were consistent, seeing the same data across all 3 of those statements.
Now, before you start worrying about paper costs and postage that goes with all of that paper, the other strategic decision that we offer is electronic statements. And we do a lot of servicing through our portal. We've built a patient portal for Steel Memorial where patients can self-serve and really make payments when and where they want to make payments. So Tammy, that was a huge strategic advantage with the e-statements. Could you give this audience just a little overview of how that process has worked and what our response rate is?
Yeah, so it's been very, very successful. I think our response rate is up in the 90% of the patients who are choosing to go to the e-statements. And the great thing about e-statements is it's quick, it's secure. You don't have to wait for the mailing time for them to get those statements. So, if you're mailing a long time away, sometimes you'll have 5 to 10 days of mailing time, versus if you get the e-statements, you're getting it the next day. So the response, people pay quicker with the e-statements. And so, we try to implement that as much as possible. And especially with the portal, logging in and collecting those. We've actually, I think our unsubscribed rate is only about 1%. So very, very low, very successful in patients adapting to that technology.
Steel Memorial does a great job with their community outreach. They do a lot through their local radio station and then also through their Facebook page. So if you're a smaller system, a critical access rural health center, you don't have to have a huge budget to do patient outreach. I think that's the big takeaway. And Shari, from your side, have the patients been happy with the electronic experience, with the ability to self-serve and make those payments when and how they want to?
Yeah, our patients have been a lot happier because they have more options on how to pay. I think that they like the e-statements better because they're not getting a whole bunch of paper in the mail. A lot of people don't even open their envelopes. So I think that that's been a big improvement with the e-statements.
Well, and I'd love to hear you say that. I promise you guys that wasn't scripted. That was 100% off the cuff. But you think about how many times do you check your actual physical mailbox during the day? Maybe once. And there's no guarantee, Shari, to your point, that you're actually opening the envelopes. Conversely, people check their email multiple times a day. So to not, and the other thing with Steel is that all of your mail has to go through Salt Lake City, Utah. So it adds more of a lag time. So that can be a reality for other critical access hospitals as well. Okay, we started at the top. We have to be able to identify the inventory that has to take a special path. The big things are, if we don't get the claim out, if it's in a suspense period or a late posted charge or whatever that is, Annie, what do we do? What do we have to do?
Well, we have to let Ensource know that we do have late charges right away. What we've tried to do though on the front end is because, our pathology was one of our biggest late charges. It is set up in Epic to put a stop bill on any pathology that's sent out. So the account won't actually drop to billing. And then we do have one of our coders has been assigned as overall, she reviews all pathologies because we were getting like 15 to 30-day lag time. She has it down to between 5 and 7 days that we're actually getting our reports back and can get them in the system, can get those charges in and be able to drop that right away now.
Well, and it's such a great process that you've tightened up, and to have somebody designated, I think especially in the beginning, is an important takeaway. The problem with centralization is if everybody's accountable, then nobody's really accountable. So to have, especially in the beginning, one set of eyes, not saying that you don't have duplication there in case somebody's sick or has, something, but one person that can be centrally responsible to check it. Because as your service provider, we just take the information that you give us. So we're not able to understand if they were late or they didn't get the consolidated statement of services. So that's the other thing. Make sure that you have really good lines of communication. Bye, Lionel. Thanks for joining us. Oh, you have a thing.
I just have one note. I'm not leaving yet. A hidden story here that helped make this successful is Annie's ability to cross-train. So our coder also worked in the lab. So I would recommend any coders or billers to go out and spend a day or two in the service areas where charges are dropped and work on that cross-training. So I think there's a little hidden secret to success there.
Yes, very much.
No charge for that one, Lionel, because that was a good nugget. The cross training, that's really important, especially when you have smaller teams, to be able to back each other's play in case someone's out on leave or something else. Excellent strategy, Lionel. Thank you for telling us that. And Annie, good job to you. Other areas that you would ask for us to consider or talk about? Maybe wish we would have known. I know I was really excited that we got the July 1 extension. I don't know about you guys.
I don't know. We felt pretty good on January 1st.
I would just add on there is that registration is really going to be an important key. because if your people aren't registering and putting the right insurance information, and there's a lot of registration errors, that could also slow down the process of being able to get those bills out in that 45 days.
I don't know.
Who invited the chipmunks?
Oh my goodness gracious. I'm going to mute everybody and then we'll just come back on. That was hilarious. Shari, I'm so sorry that happened to you. Hang on. Let me mute everybody and then you will have to look in your lower left corner and unmute. Just if that was a question, would you please drop that in the chat, because we were unable to keep up with the frequency of the elf and the chipmunks. That was so funny. But if anybody has a question or a comment, please go ahead and drop that in the chat. Shari, that's excellent information. I think the big takeaway for each individual system here is to look at kind of who your known offenders are for the late posted charges and double down your focus on them. So specifically if pathology or your radiology, where whatever it is tends to be late to the game, start with them. And to Lionel's point, don't be afraid to cross-train. Lionel's a big fan of having people sit down from the beginning all the way through the end, so everybody understands the other side of the table, right? Access understands what billing office looks like. And Shari, those registration errors can be the bane of our existence, can't they?
Mhm.
That's an excellent strategy. Anything else from your front lines, Shari, that you would ask for us to consider?
I would just say also, like, letting the physicians also know. I think it's really important for the physicians to even know about the IPA, because they're in there and they have to code and they have to go in and document. And so, I mean, that can take a while too. So it's just letting everybody in the facility know. I mean, everybody has a part.
Yeah, and everybody's accountable. We have a really great question from Brenda to the panelists. She said that she read that the Consolidated Statement of Services had to be customized to match the exact service the patient receives, not a blanket approval for all services. Annie, would you speak to that? Because we had a conversation around that, didn't we?
Yes, although that we have all of our providers that they may get a bill from on that Consolidated Services page, we actually have to, on the very top, document what type of service that patient is receiving that day. So if it's just a lab service, then they know that when they turn it over, it's only anything related to the lab. Infusion therapy, it may be anything only if it's related to infusion therapy. So it is documented when the patient gets it, exactly what may be associated with their bill.
Brenda gave you a gold star, but I think it's really important, you guys, that we continue to beat the drum of simple systems, because none of us have huge budgets to throw at this, what might feel like an unfunded legislative mandate. So the simple systems that Steel Memorial's doing with having the patient sign and then they scan it and they upload it to Epic was sufficient for them. So if you have a system with deeper pockets and maybe more staff that you can, have deploy this, that's an option. But for Steel, we kept it really simple, and that seems to work. Now, full disclosure, we were excited about the July 1 extension just because we did have a couple stragglers that came through with our inventory that we needed to pull back. So we were actually grateful for what we considered the beta test. But that's on top of all of the statement changes that Tammy and her operations team have already done. Justin Murphy as the general counsel for Haas Group. So nice to see your shining face. Any strategies now, Justin, I know you're not everybody's attorney here, but you are our attorney. Are you giving legal advice today? How should we handle this? He wanted to join us just as a general counsel to give some just strategic advice and what we're anticipating as this comes through the rest of the country, right, Lisa? Because it's not just going to stop at Idaho. Do you think, if you were a bet?
Yeah.
I will have to say that we really appreciated the the service that Justin provided when we were coming up with our consent, because not only were we able to use him, we also used our own attorney to review the final plan, if you will. And I think that came together very well.
You're so sweet to say that, Annie, and we'll tell him that you spoke those high praises, because he's now in Zoomville trying to get back in to sound like himself. But you know, that was one of the strategic advantages. We wanted to make sure that we played the most conservative game possible because this is new legislation. I mean, at the end of the day, what did they call this? Frank's Law? Was it Frank's Law? I can't remember. I think maybe it was called Rich's Law or Frank's Law. I'm not sure. But Justin, are you back with us?
Do I sound better now?
Yay! You sound like yourself again. All right, so in the last few minutes that we have, just because we know everybody wants to eat, some guidance that you would give to our attendees that maybe are outside of Steele Memorial.
Well, you know, I jumped in earlier there at the tail end of what Sherry was saying. I guess I was the one that sounded like the chipmunk, and I apologize for that. But I wanted to point out you have to work in conjunction with, from our standpoint, the client, the medical provider, because even though there's a lot of burdens that are put on the provider about sending the statements, we actually, if we take that extraordinary collection action, if we pursue a legal avenue on an account, if we report it to a collection agency and we're challenged, or a credit reporting agency, we're challenged on that, the burden to prove that everything was done falls on us. So in a sense, essentially we're proving that the medical provider followed the statute. So we're not even proving our own actions, we're proving your actions as the provider. So just keep that in mind, that your relationships with your agencies or with any third party you're using to send out the statements, they may be a little more intrusive in their questions, and it's not because we're trying to be nosy and tell you how to operate your business, but there's liability, as I think as Callie mentioned, on both sides. We can face the liability, you can face the liability, and a lot of our actions go hand in hand and have to be sort of thought out on the front end of that. So as an attorney, I always recommend the most conservative pathway, and then let the business owners decide how much risk they want to have and go from there. But I think Callie mentioned that, this may not be just in Idaho. And just in the last couple of months, I think yesterday maybe, Maryland had a law that goes into effect in a couple of months. They have to also wait 180 days before they can send it to a collection agency. And they also have to provide a yearly report on, what is it here? So hospitals are no longer allowed to sell debt, charge interest on a self-pay account before a judgment is obtained, and they have to wait 180 days before sending it to a credit reporting agency to report it to credit. And they also have a yearly report where they have to detail how much they had in self-pay account, how many self-pay accounts there were, how many of those actually paid, what they sent to collection agencies, and things of that nature. Washington just a couple of years ago had their own law where they reduced the amount of interest that can accrue on a medical debt. They changed statements. Generally, it was a statement from the collection agency that said if you ask for it, you're allowed to get a statement from the hospital directly or the medical provider directly, and it listed, bullet point 7, 8 things that had to be on that statement, very similar to what has to be on the Idaho statement. New Mexico has recently passed a law that not only does the statement have to specify the services, it has to say whether they build insurance or not. The provider has to say whether they build insurance, what insurance they build, and if it's self-pay, whether or not they have been screened yet for financial assistance. And if anyone makes a partial payment, they have to send a receipt with all of those other items on the receipt as well as some other things around the delayed. We see a lot of this. There's delayed credit reporting. It's in the Washington law, it's in the New Mexico law, the Maryland law, and in the national law that passed the House but not yet passed the Senate. There's it covers, it's very expansive. It covers government collections, healthcare collections, but the healthcare piece, you have to wait 2 years from the day you send out your first bill to turn it over to a collection agency. There's no collections, no third-party collections for 2 years after a bill becomes due. So I definitely think we're going to have to be aware of what's going on nationally. We have 4 states just this go around implement some sort of healthcare debt collection law. We've got one that's being debated nationally, and so I believe it's going to be a big thing going forward.
And Justin, for the bill that's at the federal level, what can the healthcare providers do? Speak to their representatives, send them letters, let them know their stance on it? What's the best way to make their opinion?
I would do those things. I would talk to your the local representatives that are in your district, your part of the state, especially at the Senate level now that it's already passed the House. But I would also use whatever associations, the hospital association, medical association, if there's a CFO type of association, I'd pressure every one of the kind of trade groups that exist to assist with the lobbying aspect of these things to start putting pressure on the Senate for those type of bills.
And
What's
for
the name of the bill? I'm sorry, Lisa, I didn't mean to overtalk you, but for those of maybe hadn't heard of it, if they wanted to give it a Google, what's the name of the bill that's with the Senate right now?
Oh, I'll have to actually pull up the whole long name here.
We'll drop it in the chat. Yeah, we'll drop it in the chat for everybody.
And for those of you in Idaho, at the Idaho Hospital Association, the person you want to reach out to who deals with all the legislation is Tony Lawson. So she's your go-to person that you could reach out to. If you are not aware of this, it's good just to make sure. I'm sure that they're working on it. They've got a great crew over there at the Idaho Hospital Association, but just make sure that you guys know, that will be a huge impact, not being able to send accounts for 2 years to debt collections. So make sure that they're aware and that they're talking about it. And Justin just dropped it in there.
Yeah, and they actually have added a carve out in both the Fair Debt Collection Practices Act and Fair Credit Reporting Act in this bill if it passes, which defines medical debt as a separate line item. So debt is already defined in those acts. And so now they're going to put a subcategory of specific medical debts, and, the whole subjective medically necessary definition. They are going to say that if the procedure was medically necessary, then it can never be credit reported. And so, what is medically necessary, I think opens it up to a whole other, interpretation and
I could insert so many snarky comments right now, Justin, about a letter of med necessity. Like, it's bad enough that we got to get it for the payers. Now we got to get it for the legislators as well. I think that the biggest takeaway that I heard you say, Justin, is that we anticipate more of this, right? When we looked at this poorly wrapped present last year this time, as somebody who's spent 25 years in credit and collections, this bill makes 501R look like a walk in the park. And so our anticipation is that for anyone in Idaho, none of this is a surprise for you. We just wanted to share the case study of what Steele Memorial did and how we showcase simple systems to kind of check the boxes of all these unfunded legislative changes. But the big thing is, don't be surprised if you start seeing this come down at your state level, because as Justin said, we're seeing more and more of it. So I think that's the big takeaway. And if you ever look at your internal team and would like some additional support, anything that we can do to add value, whether we do business together or just have a conversation, all boats rise when we work together. So I'm so grateful for Steele and Janelle for the MIHA representatives and this opportunity to provide education. Janelle, do you want to close this out? Or Lisa, do you want to close this out? Do you both want to close this out? You both did so great.
I just wanted to thank everybody for joining in, and and allowing us to pick Steel Memorial's brain. You guys are the trailblazers, and so we appreciate you sharing your willingness to share and taking the time today to do that. And Lisa and Callie, thank you for organizing this education. And I know that there was a few questions in the chat that I think we addressed today. So I also know that this has been recorded, so we will get this sent out to those, or to all of you today, and then those that couldn't get on today that I know had some questions. Is there any further questions today from anyone? Or if you have questions you want to send to me, I'm happy to facilitate those after the meeting as well.
And at the bottom, if you have a question, if you just click that button that says raise hand, we will unmute you so that you can talk, or you can drop that in the chat. Either way works. So we'll give that a couple minutes.
I think the question that I have, Annie, is what was one thing that maybe caught us from left field? You know, I felt like we were pretty on this right now, but was there anything that you wish we could have done differently, or wish we would have known earlier?
I don't know that. I think that we did the best that we could within our group to hit every nail on the head, so to speak, that was mentioned in the requirements. So I think as working as a group, we did great on getting to the bottom line.
Well, and we'll keep everybody posted, obviously, as we move through this. But I think that the big takeaways are, you know, just make sure that you're working with your team to identify the accounts that need to follow a different workflow. Because one of the big changes is that you ultimately move forward to pursue a legal remedy, we need to be able to isolate the accounts that can't take that path. So we all know in credit and collections, there are so many people that have the ability to pay, but maybe not the willingness. And it just seems like it's getting harder and harder to expect patients to pay what their personal responsibility is, even despite the best of efforts internally and with support. So we are always available if you have questions, or if you'd like to continue the conversation with Steel Memorial. We'd love to broker that. Janelle, we're so grateful to be part of your MIHA preferred providers, and thank you again for the opportunity to share time and content with your members. It was such a blessing. Thanks, guys.
Thank you.
Thank you.
Bye-bye.